Hello, hope you're having a great day today. This is chapter 21, clients with orthopedic injury or rehabilitation concerns. This is part 3. We're looking at more of the shoulder today. The shoulder joint is a highly mobile and complex joint that allows for a wide range of movements. It consists of the glenohumeral joint, where the head of the humerus or the upper arm bone articulates with the glenoid cavity of the scapula or shoulder blade, as well as the acromioclavicular joint and sternoclavicular joint, which involve the collarbone or the clavicle and the sternum, the breastbone. The shoulder joint is prone to various injuries and conditions, including rotator cuff tears, shoulder impingement, frozen shoulder, shoulder instability, and arthritis. Treatment and rehabilitation for shoulder-related issues often involve a combination of exercises, physical therapy, and in some cases, surgical interventions. When it comes to movement and exercise guidelines for the shoulder joint, it's important to consider individual circumstances such as the specific condition or injury present, the stage of healing, and any limitations or precautions advised by a healthcare professional. However, there are some general movement and exercise guidelines for maintaining and improving shoulder health. Range of motion exercises, performing exercises that promote the full range of motion of the shoulder joint. This can include pendulum exercises, shoulder rolls, shoulder circles, and wall climbs. These exercises help maintain joint mobility and prevent stiffness. Focus on strengthening the muscles surrounding the shoulder joint, including the rotator cuff muscles, the supraspinatus, infraspinatus, teres minor, and subscapularis, the deltoids and scapular stabilizers. Strengthening exercises can involve resistance bands, dumbbells, or body weight exercises such as push-ups and rows. However, it's important to start with light resistance and progress gradually, taking into account any pain or discomfort. Promote good posture to maintain proper alignment of the shoulder joint. Avoid slouching or rounding the shoulders forward, and incorporate exercises that strengthen the muscles responsible for maintaining good posture, such as the upper back muscles. Incorporate stretching exercises to improve flexibility and relieve muscle tightness around the shoulder joint. Examples include chest stretches, tricep stretches, and shoulder internal and external rotation stretches. Progress exercise intensity and resistance gradually, respecting the healing process and any limitations or precautions advised by a healthcare professional. Avoid overloading or straining the shoulder joint, particularly during the early stages of rehabilitation or after a shoulder injury. Include exercises that mimic daily activities or specific functional movements relevant to your lifestyle or sport. This helps to improve overall shoulder stability, coordination, and functional strength. It's important to note that these guidelines are general in nature and individual needs may vary based on the specific condition or injury. It's recommended that they see their healthcare professional, such as a physical therapist or orthopedic specialist, who can provide a personalized assessment, a treatment plan, and exercise program tailored to their specific needs and goals. They can guide them in helping them through the appropriate exercises and monitor their progress and make any necessary adjustments along the way. This is a sideline external rotation. You see on the left, the beginning position, and the right, an end position. They're using a little dumbbell. I'm not sure if it's 2 or 5 pounds. External rotation of the shoulder refers to the movement of rotating the arm away from the body, turning the palm of the hand to face outward or backward. This movement primarily involves the external rotator muscles of the shoulder, including infraspinatus and teres minor. Performing external rotation exercise can help strengthen these muscles and improve shoulder stability and function. This is a rotator cuff exercise in which it's a prone shoulder extension, meaning you're face down and extending the arm back. You see the beginning position on the left and the end position on the right. This is the prone horizontal abduction. You can see the beginning position on the left and the end position on the right. Notice that to perform with the palm face down, if there's anterior instability present. Prone horizontal abduction is an exercise that targets the muscles of the posterior shoulder, including the infraspinatus and teres minor, which are part of the rotator cuff. This exercise helps strengthen these muscles and improve shoulder stability. With this particular exercise, you want to make sure that they are focusing on using the muscles of the posterior shoulder and upper back to initiate and control the movement. Make sure they're keeping their shoulders relaxed and avoid shrugging them up towards their ears. Maintain a steady and controlled pace throughout the exercise and start with light weights or no weights at all, gradually increasing the resistance as their strength improves. It's important to note that prone horizontal abduction may not be suitable for everyone, especially individuals with certain shoulder conditions or limitations. This is the prone 90-90 external rotation. You see the beginning position on the left and the end position on the right. The prone 90-90 exercise, also known as prone Ys or prone Ts, is a shoulder exercise that targets the muscles of the posterior shoulder and upper back. It helps improve shoulder stability, posture, and strengthen the muscles of the scapula and rotator cuff. Focus on using the muscles of the posterior shoulder, upper back, and scapula to initiate and control the movement. Make sure your client is keeping their shoulders relaxed and avoiding shrugging them up towards their ears. Maintaining a steady and controlled pace throughout the exercise, and start with light weights or no weights at all, and gradually increase the resistance as their strength improves. It's important to note that the prone 90-90 exercise may not be suitable for everyone, especially individuals with certain shoulder conditions and limitations. This is the standing empty can exercise. The standing empty can exercise is a variation of the shoulder exercise known as the empty can exercise. It targets the supraspinatus muscle, which is one of the muscles of the rotator cuff. Here's how to perform the standing empty can exercise. First, have your client stand with their feet shoulder width apart and hold a light dumbbell or resistance band in one hand. The weight should be light enough to allow for proper form and control. Have them position their arm at a 90-degree angle with their thumb pointing downward and palm facing forward. Imagine they're holding an empty can with their thumb facing down. Slowly lift the arm to the side, externally rotating the shoulder until it reaches shoulder level. Maintain control and avoid any shrugging or compensatory movements. Hold the lifted position for a brief moment, then have them slowly lower their arm back down to the starting position in a controlled manner. You want to have them repeat the exercise for the prescribed number of repetitions on one side before switching to the other side. Important tips for proper form: make sure they're keeping their core engaged and maintain a stable stance throughout the exercise, focusing on using the muscles of the rotator cuff, particularly the supraspinatus, to lift the weight. Avoid excessive swinging or using momentum or perform the movement. Breathe steadily and maintain a relaxed posture. Subacromial impingement syndrome is a condition characterized by the compression or impingement of structures in the subacromial space of the shoulder. This space is located between the acromion, a bony prominence of the shoulder blade, and the humeral head, the upper part of the upper arm bone. Common causes of subacromial impingement include structural abnormalities such as a hooked or curved acromion, shoulder instability, muscle imbalances, poor posture, and repetitive overhead activities. The compression of tendons such as the supraspinatus tendon and the subacromial bursa can lead to inflammation, pain, and limited shoulder mobility. When it comes to movement and exercise guidelines for subacromial impingement syndrome, the focus is on relieving pain, reducing inflammation, restoring shoulder mobility, and improving strength and stability. Here's some guidelines. Rest and activity modification. Oftentimes you need to avoid activities that exacerbate the pain and worsen the symptoms. Modify or limit repetitive overhead motions or activities that cause strain on the shoulder. Range of motion exercises. Gentle and pain-free range of motion exercises help maintain mobility in the shoulder joint. Pendulum exercises, shoulder circles, and wall slides can be beneficial. Stretching exercises help improve flexibility and reduce muscle imbalances. Focus on stretching the muscles around the shoulder, including the chest, posterior shoulder, and upper back. Strengthening exercises. You want to strengthen the exercise muscles of the rotator cuff and the surrounding shoulder muscles. That is crucial for stability and support. Start with general resistance exercises and gradually progress to more challenging exercises as tolerated. Examples include rotator cuff exercises, subscapular stabilization exercises, and shoulder external rotation exercises. Postural correction. Address any postural issues that may contribute to subacromial impingement. Focusing on maintaining good posture during daily activities and exercises. It's important to note that the specific exercises and intensity of the program should be tailored to any individual's needs and guided by their healthcare professional or qualified physical therapist. They can help them assess their condition and provide appropriate exercises and ensure proper form and progression to optimize their recovery and minimize the risk of further injury. Humeral joint anterior instability, commonly known as shoulder instability, refers to a condition with the humeral head, the upper part of the upper arm bone, dislocates or subluxates, partially dislocates from the glenoid fossa of the shoulder blade in an anterior or forward direction. This can occur due to various factors, including traumatic injury, repetitive overuse, or structural abnormalities. When it comes to movement and exercise guidelines for the glenohumeral joint anterior instability, the primary goals are to restore stability, improve shoulder strength, and enhance proprioception, which is the sense of joint position and movement. However, the specific exercises and treatment approach may vary based on the severity of instability, individual factors, and recommendations from healthcare professionals. Here's some general guidelines. Immobilization and rest. In cases of acute instability or significant injury, immobilization with a sling or brace may be necessary to allow for healing and reduce further stress on the shoulder. Resting the shoulder and avoiding activities that worsen the instability is important during the initial phases of recovery. A physical therapist can play a crucial role in guiding the rehabilitation process. Initially, treatment may focus on pain management, reducing inflammation, and improving range of motion. As the condition progresses, strengthening and stabilizing exercises will be incorporated. Gentle and controlled range of motion exercises help maintain mobility in the shoulder joint and prevent stiffness. Initially, these exercises may be performed passively or with assistance to avoid exacerbating instability. Strengthening exercises for the rotator cuff muscles and the surrounding shoulder muscles are essential to improving stability. Exercises may include scapular stabilization exercises, rotator cuff strengthening exercises, and dynamic shoulder stabilization. Resistance bands, weight, and body weight exercises can be utilized based on individual capabilities and progress. Training exercises that focus on enhancing proprioception and neuromuscular control of the shoulder joint are crucial to improve stability and prevent recurrent instability episodes. These exercises improve balance training, proprioceptive drills, and functional movements that challenge stability. These are safe zone exercise positions. Notice that the arm should be below the shoulder level in A and in front of the body's frontal plane in B. Safe zone exercises generally refer to exercises that are considered safe and beneficial for individuals with specific conditions or limitations. These exercises are typically selected to minimize stress or strain on the affected area while still providing benefits such as strength or flexibility or stability. The specific safe zone exercises will depend on the individual's conditions or limitations. Rotator cuff repair is a surgical procedure performed to repair a torn or damaged rotator cuff in the shoulder. The rotator cuff is a group of muscles and tendons that surround the shoulder joint, providing stability and ability and allowing for smooth shoulder movement. When a rotator cuff tear occurs, it can cause pain, weakness, and limited range of motion. After rotator cuff repair surgery, it's important to follow specific movement and exercise guidelines to promote proper healing, restore shoulder function, and prevent complications. Here's some general guidelines for movement and exercise after rotator cuff repair. Immobilization and protection. Immediately after surgery, your shoulder may be immobilized with a sling or brace to protect the repair and allow the tissues to heal. You want to make sure that your client is following their surgeon's instructions regarding the duration of immobilization and limitations on movement. Passive range of motion. In the early stage of rehabilitation, passive range of motion exercises may be performed with the help of a physical therapist. These exercises involve gentle movements of the shoulder joint, but the muscles are not actively contracting. You have active assisted range of motion. As healing progresses, your client can begin to perform active assisted range of motion exercises. These exercises involve them using their own muscles to move the shoulder joint with some assistance from the other hand or from you. As directed by their surgeon and physical therapist, they will progress to performing active range of motion exercises without assistance. These exercises focus on regaining full, pain-free range of motion in the shoulder joint. Once the surgeon and physical therapist determine it's appropriate, then they can start with gentle stretching, exercises for the rotator cuff and surrounding muscles. These exercises typically begin with light resistance or body weight and gradually progress as tolerated. As the shoulder continues to heal and gain strength, they will advance to more functional and sport-specific exercises tailored to their specific needs and goals. These exercises aim to restore full shoulder function and prepare them for activities that require greater strength, stability, and coordination. It's important that they follow the specific guidelines provided by their surgeon and work closely with the physical therapist prior to in that rehabilitation process.